Good evening. My name is Ken Williams. This is Module 6 for Pharmacology at Aspen University, and today I will be discussing medication noncompliance. First, I'll start off by describing what is medication noncompliance, and then I'll discuss reasons why patients engage in medication noncompliance. Then I'll talk about some of the risk factors that can occur when patients aren't taking their medication as prescribed by their prescribing provider. And then I'll talk about some ways that us as potential new counselors can address medication noncompliance with our clients. And so first I'll begin with what is medication noncompliance. And basically what medication noncompliance is when a patient is taking their medication not as prescribed by their prescribing provider. And so medication noncompliance can happen in two ways. One, the patient can underuse the medication. The other way is a patient overusing the medication. And so there's many different reasons why patients would engage in medication noncompliance. And so I went and looked at the American Medical Association, and they gave 8 reasons why patients would engage in medication noncompliance. And so we'll discuss that. The first reason is they're afraid of the side effects. And so sometimes you can see this with patients that have chronic health conditions and they're taking medications that make them feel nauseous or make them woozy or throw up or cause some type of bleeding or loss of appetite and things like this. And so oftentimes they'll take the medication if they're in pain or if they're experiencing symptoms from their chronic health condition. But when they're not experiencing symptoms from the chronic health condition, they choose not to be nauseated. They choose not to experience those side effects. And so what this ultimately results in is them becoming non-compliant with their medication and not taking it as prescribed because they don't want to experience the side effects when they're not actually feeling pain or the symptoms of their actual condition. The second reason is, and this is a reason that's out of the control of the client, and it's the cost of their medication. Sometimes we have clients that are uninsured or underinsured. And so they cannot afford the medication because it's very expensive. And so what they ultimately do is either preserve the medication. And so let's say if the medication is very expensive and they want to extend the life of their supply, they'll end up taking the medication only when needed and not as prescribed. And so what happens is that they become non-compliant because they're taking the medication as needed in order to extend the supply. So if they're experiencing pain, they'll take the medication so they don't have to continue to pay these high costs in refilling the medication. So that's reason 2 of why patients become non-compliant. Reason 3, a misunderstanding of the need for medication. And so basically, this is also can be something in somebody who's experiencing a chronic health condition or somebody who's experiencing a new sickness that's brought on. Let's say that they're taking a medication and they don't feel any changes in pain levels, or they don't feel any change in their condition. They may find it in themselves that, hey, what is the purpose of me taking this medication? I don't feel any change. And so when they don't feel any change, it increases the chance of medication noncompliance to where they stop taking the medication, or they only take it when the symptoms is when they're experiencing the symptoms of their sickness. The fourth reason is the amount of medication that is prescribed to a patient. And so basically, you can see this sometimes with patients that have multiple chronic health conditions or multiple issues to where they're prescribed 4 or 5 medications. And if you have ever seen one of those daily boxes or medication containers that have the Monday, Tuesday, Wednesday, all the way up, and they have several medications, some patients get discouraged by the amount of medication that they have to take, 4 or 5 pills a day. And so sometimes they may skip a pill, or they may not, may forget to take a pill. The fifth reason why some patients become non-compliant with their prescribed medication is they're not experiencing symptoms at the time, or they're experiencing lack of symptoms. Reason number 6 is mistrust in medicine, Western medicine. And so sometimes, and this is common also, and a lot of people can be influenced by social media, influenced by news, or just lose trust in Western medicine. Number seven is just worrying about addiction, especially with pain medication, Vicodin, and things like that. A patient will be afraid that they may become dependent on a medication or addicted to another medication later because of their need for a pain medication or something like that. And so that fear of addiction causes them not to want to take a certain medication that they're prescribed. And so that can cause a client to go into medication noncompliance. And the final reason, number eight, is depression. Sometimes a patient just has a loss of motivation, and don't look forward to a life of having to take medication. So what are some of the risks that come with being non-compliant with a prescribed medication? What happens is that you risk the condition worsening, you risk death, you risk quality of life. Again, you could reach that point of no return to where, you can take the medication where it can kind of just subdue the condition from getting worsening, but it can't no longer get better and start to backtrack you back to being able to live some resemblance of a normal life. And so those are some of the risks that you face. And even with individuals that overtake their medication and take it as not prescribed and overuse, and they maybe become dependent or addicted to a certain medication, a pain medication or something like that. They're at risk of losing their right or their ability to get more medication. Once signs are there that medication abuse is going on, or abuse of that prescribed drug, a physician may put a stop or a hold on a patient going to request more of that medication. And so then that can result in condition getting worsening, or the overuse can cause for addiction. And last, what are some techniques that counselors can use to address medication noncompliance when meeting with a client? I think that just communicating, listening to the client and communicating, letting the client be empowered to make the decision for themselves, for their families, their loved ones, friends, and just the quality of life. I think patients want to have some sense of control. And so allowing them to have a voice on the medications that they choose. And obviously that would be with their prescribing provider. But as far as counselors meeting with them, speaking with them, I think a strategy that's good to use is just follow-ups. If a patient is knowingly not in compliance with their prescription medication, and you discuss it and they say that they're going to get in compliance and they do get in compliance, just those follow-ups when you meet with them. Hey, how's things going? Are you taking your medications as prescribed? And then just having those conversations and those dialogues and allowing them to talk, allowing them to share, allowing them to talk about has their quality of life improved, is the medication working, and things like that. And so as long as they feel like they're in control and have some voice and some say so about the things that they're putting in their body, even though they're prescribed from their physician, that they have a sense of empowerment over their lives.